Knee injuries are something that athletes at all levels have to deal with. Dr. Thomas Gill serves as the team doctor for the Red Sox, Patriots, and Bruins, and he's among the very best in the world at finding ways to repair those injuries, constantly looking for new techniques and technologies to get people back on their feet.
Brady with time, hit as he throws the ball, that is complete.
It's an athlete's worst fear, a serious knee injury.
And Tom Brady got hit right on the knee. He got hit right on the knee.
Fortunately for the Boston sports teams, they have some of the best medical professionals in the world to treat them.
The thing about medicine is you always have to live with your results. You're always only as good as your outcomes are. No matter how great your surgery is, or I should say how great you think your surgery is, it all comes down to how you care for your patients and whether they get better or not.
Already working with the Patriots and Bruins, Dr. Thomas Gill joined the Red Sox after the 2004 season.
Like with most things the Red Sox, the Patriots, or the Bruins do, they all have the same answer, we just want to be the best. And so when they said that, I said, well, for my idea of being the best, it's a little bit different than probably some of the other models around the league, meaning rather than just doing reactive care, waiting for a player to get hurt, I told them that my concept was, we'd want to do some preventative medicine.
Dr. Gill's forte is knee surgery. There are two parts to fixing devastating knee injuries, the surgery and the rehab. They are equally important.
We'd have, other couple of famous examples recently of players on our team that had ACL and MCL injuries in their knee. And then to me, what I really care a lot about is, 30 years from now, what's going to be the effect on this player's life. A lot of these guys have young kids, and they're going to be able to play ball with their kids growing up. They're going to be able to be active well into life.
Among those famous examples, Tom Brady and Wes Welker. And having patients like those help push Dr. Gill to constantly search for better ways to operate. And part of getting better is using new ideas and techniques, like 3D MRI imaging, to very precisely measure how much someone has recovered from surgery.
When someone says, how you doing after your surgery, rather than going from looks good, now we can kind of say, well, we've got your internal and external rotation recreated to within 1.2 degrees. We can really drill down and tell an athlete exactly how well they're doing.
Another tool Dr. Gill and his team use, robots to test new ways of knee reconstruction.
As I do one of my reconstructions using my current technique and then a new technique that we might think might be better, and we test it on the robotic arm, and then if the results are promising, I can then take that work that I did in the lab and bring that to the operating room. It's not science fiction, it's very real.
Another challenge for Dr. Gill, the attention his care of big-time athletes gets.
The unique thing about Boston and the Boston sports world is you can operate on the ambassador to France, or you can operate on a famous religious leader, which in the big scheme of life really affects a lot of different people depending on how they recover. But if one of your local athletes is operated on and has trouble, that's what you're going to read about, that's what you're going to hear about. That's what, if I see a group of patients in the office, everyone's going to want to spend 15 minutes talking to me about.
But Dr. Gill, working on those professional athletes, also has some added benefits for his other patients.
What we've kind of used some of our patients or athletes who are our patients as an impetus to go to our lab, work in our biomechanics lab, work in our tissue engineering lab to try to regrow cartilage or fix ligaments better. We take the problems that are presented to us, we take these new approaches, and then I apply them to every patient who walks in our front door, whether it's a little league kid or it's a 70-year-old who's just trying to stay fit. So it's really the benefit of what we've learned from the professional athletes that then we take to our normal group of patients as well.